One of the big responsibilities that nurse navigators have is following patients for long periods of time. So the focus of what I'll be talking about is late effect side effects. So we all know about side effects that happen while people are undergoing treatment with chemotherapy, radiation therapy. And we know about long-term side effects that last 2 or 3 years after completion of therapy. The focus of what I'm going to be discussing is actually those things that happen after 5 years. We know some of it is just what happens with the body, the fact that DNA becomes altered, sometimes with radiation therapy and with chemotherapy, which can lead to second cancers. The other thing that we know happens is that there are certain side effects, such as osteoporosis, that we don't see until 5-10 years after the person actually has completed all therapies. And so the focus is on that. One of the issues we have with this population of patients is many of them have navigated away from the oncologist and his practice and are only seeing him sometimes only annually. Many times it's the nurse navigators who follow these patients many times until the end of their life who actually are picking up these side effects. What's important about that is that many of these side effects, if caught early, even though it's a late side effect, if it's caught early, we actually can do some interventions and help protect that patient. The other thing we need to remember is that many of these symptoms that the patients have are actually key indications that possibly the person has had a recurrence of their cancer or has developed a second cancer due to the treatment that we gave them. And then of course we have patients, because of the fact that these patients have already had cancer and maybe metastatic disease, their bodies already know how to produce other cancers. They've learned how to metastasize. And so the other part is picking up those new cancers that have nothing to do with the original cancer, but many times are actually found on these subsequent annual visits. And so that's a real big role of what nurse navigators are about, because following these patients for long periods of time, these are the kind of things. So educating the patients and their families to look for things like diabetes, like osteoporosis, like hypothyroidism or hyperthyroidism, etc. Those are the late effects that I'm going to be discussing in this session.